The opioid crisis has gripped the world, and the desperate need for non-addictive painkillers has never been more critical. For years, the options for pain management have been limited to over-the-counter drugs like aspirin or potent, addictive prescription opioids like oxycodone. As the opioid crisis rages on, the risks of addiction and misuse have led to a significant decline in opioid prescriptions over the past decade. Despite these challenges, there's a glimmer of hope on the horizon. Vertex Pharmaceuticals, a Boston-based drug maker, recently reported encouraging results for a non-opioid painkiller. This novel medication, one of several they've been developing, showed promising signs of more effective pain relief after surgery compared to a placebo. However, it's not a magic bullet yet. It didn't outperform treatment with an opioid. What if there was a solution, a non-addictive alternative that could revolutionize pain management? That's where Dr. David Altshuler of Vertex Pharmaceuticals steps in. Why the need for new drugs in pain treatment, you ask? Let's hear it from the expert himself. Dr. David Altshuler, Vertex's chief scientist, emphasizes the profound need for additional medicines to help people manage pain. There are medicines like Tylenol that are modestly effective and well tolerated. Then there are medicines such as opioids that are very effective but unfortunately have serious side effects along with addictive potential. Dr. Altshuler passionately articulates the significance of identifying additional medicines for individuals who require more pain relief but do not want to risk the dangers associated with opioids. This would be tremendously beneficial for society, he adds, underscoring the societal impact of this medical challenge. It is clear that the need for alternative pain treatments is not just a medical necessity, but a societal one as well. In the quest for pain relief without the risks of opioids, Vertex has been on a 2-decade journey. How were these non-addictive painkillers developed? Let's delve into the fascinating science. Dr. Altshuler shares that Vertex has been working on this for 20 years. The breakthrough came from studying individuals with a rare condition making them insensitive to pain. Imagine being able to walk on hot coals without flinching. This was the reality for a family of firewalkers who, due to inherited differences in a specific protein, did not experience pain. This protein plays a critical role in pain signaling. When you lack this function, you don't feel pain. Inspired scientists, including those at Vertex, spent decades developing a medicine that could mimic this naturally occurring phenomenon. But the aim wasn't to create another potential source of addiction. Our goal is to make medicines that act in the periphery, not in the brain, says Dr. Altshuler. The goal? Medicines that act in the periphery, not in the brain, eliminating the same potential risk of addiction. What does the recent data suggest? And what's next in the pipeline? When we dive into the recent data, it's evident that the journey to develop non-addictive painkillers has made significant strides. Dr. Altshuler shares that Vertex Pharmaceuticals has reported 3 promising studies on patients with acute pain, such as post-surgery or injury-related pain. All 3 studies were positive, showing a substantial reduction of pain by approximately 50%. But how do these new drugs compare to opioids, you may wonder? According to Dr. Altshuler, while these non-addictive painkillers were not superior to opioids, they were similar in magnitude. Now, the critical distinction here is that while opioids are effective, they come with a host of safety and tolerability issues. As such, a medication that can provide similar efficacy but without the associated challenges of opioids could be a game changer for those living with pain. It's not just about acute pain, though. Dr. Altshuler tells us that Vertex has also been testing this approach on patients with long-term pain. Specifically, they've conducted a study on diabetic peripheral neuropathy, a form of long-term pain that occurs when individuals with diabetes experience nerve damage. This expands the potential reach of these non-addictive painkillers to include not just those dealing with temporary pain, but also those grappling with chronic pain conditions. As we look to the future, the potential of these new drugs to revolutionize pain management is undeniable. The recent data is promising, and the ongoing research is encouraging. But it's the potential impact on millions of people living with pain that truly stands out. For them, this could be the dawn of a new era. An era where managing pain doesn't mean risking addiction. An era where patients have more options and greater control over their pain management. As Dr. Altshuler and the team at Vertex Pharmaceuticals continue their vital work, we can only watch and hope for the best. As we look to the future, the potential of these new drugs to revolutionize pain management is undeniable. For millions of people in pain, this could be the dawn of a new era.